So overweight is defined as a BMI greater than 25, and obesity is defined as a BMI greater than 30. Really, it's just a glorified height and weight calculation. So we could have two people that weigh exactly the same. We could have two people that both weigh 150 pounds. One person could be extremely muscular. The other person could have a lot of fat. Hi, I'm Dale Wagner. I'm an exercise physiologist in the kinesiology and health science department at Utah State University. Certainly in the US, at least, our culture is kind of based on the scale. You always hear people say, well, how much do you weigh? How much do you weigh, right? You almost never in conversation hear someone say, well, what is your body fat percentage? Some people get frustrated when they exercise and they don't see a change in their scale weight. And that's understandable. They could be losing fat at the same time that they're gaining muscle mass. And so they might not see that much of a change in their weight. And in some cases, especially if they're doing a lot of resistance training, they might actually see their weight increase. But yet they're a healthier person because they have more muscle mass. We have a lot of different methods for measuring body composition. Every method has a pro and a con, or strengths and limitations to them. And so the upside of laboratory methods is that theoretically they're the most accurate. The problem is, of course, you have to go to a research lab in order to be tested. You know, we can't bring the machine to you. You have to come to the machine, basically. Yeah, so as far as the field methods go, most people are probably most familiar with the Skinfold Caliper. With the Skinfold Caliper, you would take an area of skin and you're gonna pinch and pull, and then you put the calipers right below where you're holding the fold. And of course, it's gonna give you a reading in millimeters. So basically what you're measuring here is the millimeters of thickness of the fold that you're grabbing onto. And then that information goes into a prediction equation. There's certainly variability in how people pinch and pull. And so you want to try to get to a point where you're standardizing that. Myself, I've been doing skin folds for 30 years, and I still don't trust myself doing a skin fold measurement on people who are obese. It's just common sense. The more you have to pinch, the greater the error or the mistake you're going to make. We know that a field method is not going to be as accurate as a laboratory method, but it can be close. In other words, is it good enough? That's what our research focuses on. We do validity and reliability research to try to determine if a field method is acceptable enough to be used in an everyday setting in a fitness center. Just a couple years ago, we did a study that was actually part of what's called an ERCO grant, undergraduate research. And so we had 3 undergraduate research students who are all now in med school, and they were interested in the reliability and validity of an app. So there's an iPhone or iPad app that you can download, and it's really pretty simple. You just take 2 pictures of a person. So you're holding your iPhone or your iPad, and you take a picture of a person with a frontal view and then a side view. And then there are some crosshairs on the app that you put at various locations. So for example, at the neck, at the waist, and the app sort of walks you through the procedure as to where to put those crosshairs. And then it would give you a % body fat, right? And so you can see the upside of that. This is incredibly simple. Most people have access to a smartphone or an iPad. The app was very inexpensive, only a few dollars. We did a validity and reliability study on this using our BOD pod as our criterion method, or our standard, which we were going to compare this to. What we found was that the app was very reliable. In other words, if we took multiple photos, we would get the same information every time. And so that was encouraging. Unfortunately, it wasn't valid, so it didn't give us, I wouldn't trust the numbers from the app, basically, right? So if it tells you you're 30% fat, you might be 30% fat, but you might be something very different from that. A lot of people look at the DEXA scan as, quote unquote, the gold standard. Even that has its limitations. There's no perfect standard for body composition measurement. The really nice thing about the DEXA scan is that you can get regional or segmental body composition. So for example, we can measure your right arm versus your left arm, your limbs versus your trunk. Fat on the trunk is called visceral fat, and there's a much higher relationship or correlation with that to most of the diseases that we associate with obesity. So cardiovascular disease, diabetes, high blood pressure, and so forth. And with a lot of our other methods, so underwater weighing in the bod pod, we only get total body fat. We can't distinguish where that fat is. Another method of body composition that is common is bioelectrical impedance or bioimpedance. If you have a bathroom scale that gives you % body fat, your scale is actually sending a low-level electrical current through your body, so low that you can't feel it. Whether you use the scale or the handheld method or more sophisticated research device, the basic principle is all the same. It's injecting an electrical current, and then it's measuring the impedance or the resistance to that current. Certainly the method's easy, much easier than the Skinfold calipers. And so for that reason, a lot of people like it because they feel more, in terms of technicians, they feel more confident using the bioelectrical impedance method than the Skinfold method. For obese clients or overweight clients, I myself, if I had to choose between the Skinfold caliper or the bioimpedance, I would use the bioimpedance for overweight or obese individuals. The limitation, or one of the major limitations of the bioelectrical impedance, is that because it's an electrical current, it's very influenced by hydration status or by water. And so if you do a hard gym workout and you've sweated a lot and you've lost a pound of weight just from sweat, and then you measure yourself with the bioelectrical impedance, I wouldn't trust the measurement that you get from that because of the fact that you're in a dehydrated state. And so you really have to be in what we call euhydration or normal hydration. Some people get frustrated when they exercise and they don't see a change in their scale weight. And that's understandable. They could be losing fat at the same time that they're gaining muscle mass. And so they might not see that much of a change in their weight. And in some cases, especially if they're doing a lot of resistance training, they might actually see their weight increase. But yet they're a healthier person because they have more muscle mass.